Well, welcome back to Psyence Biomed's a channel where they focus on botanical psilocybin medicine. Joining to discuss operations and some pretty pivotal news, Dr. Neil Moreski, joining as always from the board. Welcome back, sir.
Thank you, Carl. Great to be back.
It was a pleasure to get you back on. So I guess I really want to dive into the fact that you recently closed on that acquisition of Science Group's stake in PsyLabs. And for newer audiences, maybe tell us what PsyLabs is doing and kind of what this means for the company.
Yeah, so PsyLabs is a very interesting collaboration of ours. They are a privately held psychedelic growing company, natural psilocybin in Southern Africa. And we recently closed on a minority stake of ownership of their facility. And also, you may remember that in the more recent past, we announced the exclusive licensing of their product for our second indication, which is alcohol use disorder. This is a license that is exclusive for our R&D and commercial purposes. And when we ramp up our efforts in AUD, which is alcohol use disorder, which is an incredibly debilitating disease, we have a vertically integrated supply chain. We have a stake in this company, and we fully vested in this new indication.
No, I definitely appreciate all the insight there. And you kind of mentioned on it with that second clinical trial site, kind of just moving forward here. I think it'd be good to kind of scale. Tell us exactly what's going on and what investors should focus on here. I know we're kind of finishing up 2024. We got through the election. Does any of that play an effect to what you guys are doing? Maybe just kind of give a broad view of the operations.
Sure. So that's a separate release that we announced more recently in that for our clinical trial, our phase 2B clinical trial in Australia, which is in palliative care with natural psilocybin and psychotherapy, we've expanded our clinical trial sites to 2 sites. As you know, recruitment is a critical success factor here, and we want to ensure that we are recruiting patients to the maximal advantage that we can. So we are looking at many sites, but currently we have 2 on board. As they go through the regulations of the authorities, we'll be able to begin screening maybe later this month and hopefully have a patient in by the end of this year, which is our aim, and then start recruiting fully and execute the complete clinical trial in 2025. You're right, the election did happen. And it's a new government, and maybe it's a new focus on the approach to psychedelic research, and the actual acceptance of psychedelic medicines as a new innovative way for addressing mental health challenges as we go forward. So I look forward to seeing what the new administration's view is on this matter.
On that note, I'll pass it off to the viewers. We'd love to know what you think. Consider subscribing when news catalysts like this hit the wire. We're going to bring it to you here. But on that note, we look forward to catching you in the next one.